Ain't ever.
Parents ought to make sure their children are vaccinated.
Former Florida Governor Jeb Bush, just a few minutes ago, we just got that in. He was in Detroit and he was asked a question about vaccines. It seems like everyone is being asked that question. He's just the latest potential 2016 contender to speak out. The measles outbreak is advancing, and that's one thing driving these questions. As we speak, that outbreak spreading across the country. Right now, at least 102 cases across 15 states. Dr. Lolita McDavid is a pediatrician as well as the medical director of child advocacy and protection at the Rainbow Babies and Children's Hospital in Cleveland. So she navigates this almost every day in her work. Dr. McDavid, I want to get your practical take. Take a listen to this from CDC Director Tom Frieden. He was talking to my colleague Andrea Mitchell and addressed some of this.
Study after study has shown that there are no long-term adverse consequences. That's why I made sure my kids get vaccinated. But it's not just about your kids. It's about your neighbor's kids. It's about the kid who can't get vaccinated because they've gotten treated for cancer, or the baby who is not old enough to get vaccinated yet. And measles can be serious.
But you must deal with parents who just say, absolutely not. We're convinced, even in spite of all the scientific evidence, that this is a risk. Do you think those parents should be forced to vaccinate their kids?
Well, actually, I don't know parents who are like that. I mean, when a new baby comes into my practice and I explain to the parent, we're going to be immunizing the baby at 2 months, 4 months, 6 months, and then again when they turn a year, and that's when you get the MMR, the measles, mumps, and rubella vaccine. And I explain to them why immunizations are so important. I tell them that with the introduction of the Hib vaccine, within 6 years, we eradicated the #1 cause of bacterial meningitis in children under 6 years of age. And they go with me. Now, maybe there are some people who go somewhere else, but I don't seem to have that kind of problem. I think that part of it is that you have to have a relationship with the families, and you understand that you and the parent are partners in the care of their child.
And doctor, what do you think of these states that allow personal belief exemptions from getting your kids vaccinated? California, where this outbreak originates, is one area where there are a lot of invocations of that personal belief exemption standard. Do you think that that shouldn't be allowed?
But California does not allow a personal belief of not putting a child in a car seat and not having a child in a restraint. So what is the difference? Are we able to get in one more question, folks? I would love to ask you about just the political frenzy about this before we part ways here, Doctor. Every candidate, it seems, with a prospect for 2016 weighing in on this, would you personally vote for one who says, I don't think vaccinations are safe? Well, I don't discuss who I vote for, but I would probably be at one of their press conferences and asking them about why they felt that way. You know, it's one thing when you have grown children and they're healthy and they're safe. It's another thing when you have a baby and the baby is at risk. The problem with measles is you are contagious 7 to 14 days before you even have any symptoms, and it's highly contagious. It's, you know, just drop. So if you come into somebody's pediatric office and you've got 2 or 3 pregnant moms there with other children and little children, all of those people are at risk.
Dr. Lolita McDavid, thank you for taking the stand on this. Always appreciate getting your clear voice. And you've got an impassioned take on this in the audience, we know, because we're watching the tweets come in. And if that's the case, if you're one of those people, you can do something. For our call to action this week, you can head to our website and sign a petition. It's a letter addressed to CDC Director Tom Frieden, and it calls for making some types of vaccines, like the measles vaccine, mandatory in order to enroll in public school. One way to end outbreaks of dangerous and easily preventable diseases. You can get involved. Let us know what you think using the hashtag #RoNation after you sign. And it's a murder mystery that reaches to the highest levels of the government in Argentina.